What causes high airway resistance during breathing? Imagine trying to breathe through a straw that suddenly gets narrower. It becomes much harder to draw air in and push air out. That's similar to what happens when airway resistance gets high in your lungs. When you breathe, air flows through a network of tubes called airways. These tubes range from large to tiny, and their size really affects how easily air moves. If the tubes become smaller, it takes more effort to breathe. This is because the resistance to airflow increases as the airway diameter decreases. Even a tiny narrowing can make a big difference. One common cause of narrowing is bronchoconstriction. This is when the muscles around the airways tighten up, which often happens during asthma attacks. When these muscles contract, the airway becomes smaller, making it harder for air to pass through. Mucus buildup is another factor. When excess mucus lines the airways, it acts like a partial block, reducing the space for air to flow. Infections or allergic reactions can cause swelling and inflammation of the airway walls, further narrowing the passages. Sometimes, structural issues like a deviated septum or enlarged tonsils can block the upper airways, increasing resistance. The type of airflow also plays a role. Air normally flows smoothly in a pattern called laminar flow. But if the airflow becomes turbulent, which happens when air speeds up or the airway surfaces are irregular, resistance jumps significantly. Turbulent airflow is chaotic and requires more force to maintain. The elasticity of lung tissue influences airway resistance too. When the lungs expand during inhalation, they pull the airways open, easing airflow. But if the lung tissue loses its elasticity, or if there's increased pressure outside the lungs, the airways can collapse or narrow, making breathing more difficult. The physical properties of air are also factors. Thicker or denser air, like in cold or polluted environments, can increase resistance slightly because it's harder for air molecules to move. Certain health conditions can cause persistent high resistance. For example, upper airway resistance syndrome involves narrowing of the upper airways without complete closure. This makes breathing harder and requires extra effort from the muscles involved in respiration. Nerve damage or anatomical abnormalities can also contribute to increased resistance. In essence, high airway resistance during breathing mainly happens because the airways become narrower due to muscle tightening, mucus, swelling, or structural issues. Changes in airflow patterns and lung mechanics also add to the challenge. These factors make the muscles work harder to move air in and out, which can lead to breathing difficulties. Recognizing these causes helps in diagnosing and managing respiratory problems effectively.